Good morning. Welcome to Japan. It's been very cold lately. How have you been doing? It's the season when we worry about sleeping. Even with fun winter sports, we have to concern about a chance of an unexpected accident. When we hurt somewhere, one of the biggest question is when we should see a doctor. If you hit your head hard and lose consciousness, then without question, you should call an ambulance for help. But what about injuries to the arms or legs? This week, I'd like to talk about injuries to the limbs or minor injuries. What signs mean you should see emergency care and what kind of first aid you can do. When you get injured, it's natural to worry about many things. Did the muscle tear? Is the ligament okay? And of course, if there is a fracture, you might think, oh no, this is going to take a long time to heal and feel discouraged. But in reality, these kinds of injuries often require very careful and thoughtful treatment. Sometimes it's necessary to wait, reassess the injury several times, and then make a professional judgment about whether surgery is truly needed or physiotherapy is more appropriate, rather than trying to fix everything all at once with an emergency treatment. There are many cases where choosing a careful, specialized approach, one that you can say years later, I'm glad I chose this treatment. This is the better option. Imagine this. One day, you suddenly have a shocking life change encounter and you decide it's time to meet your partner's parents. In Japan, you take off your shoes before entering a home. And of course, at a moment like that, oh no, why is there a hole in my sock? What would you do? That could be disrespectful to the parents. You'd need an emergency fix. You might rush to find a convenience store for a pair of socks. But even though something feels absolutely necessary and you want it urgently, would you buy an engagement ring at a convenience store? Probably not. Most people would prefer to wait a little and find out what kind of a preference your partner has and what can fit to your partner. Choose something professional and meaningful and make a decision they won't regret for the rest of their lives. Medical treatment is something similar. There is an emergency care and a specialized care. It might seem convenient if both were always available at once. But maintaining a system that can do everything all the time is very difficult. It also increasing these medical costs. And maybe you have to pay a lot for your socks. And ultimately raises taxes as well. If it would be wonderful if we could use our existing medical resources wisely and carefully. Another important point is that right after an injury, the full extent of the damage may not be yet clear. If a wound is stitched up throughoutly at the beginning, it can later require a major surgery to reopen the wound and redo the treatment sometimes. In some cases, it's better to treat things roughly at first. Address only what's urgent, and then carefully monitor the healing process before proceeding the definitive treatment. In the long run, this approach can result in better healing, less physical strain on the patient, and lower financial burden as well. That's why it's crucial to clearly recognize when a situation is truly an emergency, and otherwise to make an appointment for proper specialized care. So when exactly is emergency care necessary? There are 3 key points: blood flow, nerves, and infection. First, let's talk about blood flow. Blood flows from the heart towards the fingertips and toes. So if you injure a limb, blood may spurt out forcefully from the wound. If firm pressure stops the bleeding, that's reassuring. But if blood is spurting continuously, that's clearly an emergency. Apply a pressure on the side of him bleeding and seek emergency medical attention as soon as possible. Severe blood loss can occur, and it can be life-threatening. However, bleeding isn't the only issue. If blood is not flowing to the area beyond the injury, that's an emergency too. If blood doesn't reach the issue beyond the injury, oxygen and the nutrients can't get there either. The tissue can die, turn black, and eventually may need to be surgically removed. So first, stop the bleeding properly, and but after that, it's equally important to confirm the blood flow is still present. To stop bleeding, your fingers are enough, usually. Normal systolic pressure is around 140 millimeters of mercury, and even when very high, about 200 millimeters of mercury. That means finger pressure is sufficient. So the important thing is find out where the bleeding is occurred. Most blood vessels are smaller than a finger, then use your finger. But if multiple vessels are injured over a wide area, use both hands to apply firm pressure. And anyway, call an ambulance as soon as possible. Then check circulation. Is the injured hand or foot turning blue or pale? Does it feel unusually cold? Changes in color or temperature are warning signs of poor blood flow. During skiing or snowboarding, everything may feel cold anyway. So comparing the injured side with the uninjured side could be helpful. Also, checking the fingernail or toenail is also useful. Pinch the finger with your thumbs and index finger, and press on the nail. After 5 to 10 seconds, the nail will turn white. When you release it, if it turns to pink within 2 seconds, circulation to the fingertip is considered adequate. If it takes more than 3 seconds, poor circulation should be suspected. If you're experienced, you can also check for a pulse, the artery beyond the injury. For the foot, you can check the dorsal pedis artery located on the top of the foot between the big toe and the second toe at the highest point of the instep. If you can feel a pulse there, blood flow is likely maintained. For the arm, find the radial artery is helpful. You can find it near the base of the thumb. Okay, that's all for today. Next time, I'd like to talk about how to assess nerve injuries. Thank you very much and have a nice day.